I welcome once again each one of you on this Moksh Academy webinar. I am Chirag. I am the COO online coaching at Moksh Academy. At Moksh, I have been responsible to guide, to mentor students, consultants, PG physicians, and senior level doctors who plan to take their careers ahead, whether it's a residency, that's a PG, or a fellowship program, that is super specialization abroad. My experience for last 10 years have been in international education domain, where I have personally helped hundreds of students secure their residency and fellowship programs in the United States and help them with fellowship programs elsewhere. So yes, today in this next 1 hour, I am going to give you a clear picture of what are your opportunities to do PG or settle abroad, considering you are a student, an MBBS student who is a citizen of India and studying in med school in India or Asia or Southeast Asia. With this, I welcome you all on this session. My target is that end of the session, you guys also need to be equally experts in this global licensing examinations. So quickly, if you guys can let me know yourself as well. I mean, if I have introduced about myself, now it's your turn. If you could just let me know which year of med school are you in, first year, second year, third year, graduate, intern, because that just gives me a clear picture in terms of whom am I addressing to, because the planning is different. Amiri, what's your question? Could you type in? Everybody needs to type in the questions. Dr. Suruchi is asking, has the webinar started? We're just starting, Dr. Suruchi. We're just getting introduced to each other. I have introduced myself. I am just asking my colleagues about their year of med school. So if you can also participate in the poll. And yes, we begin our discussion. We are now close to about 194 students, and out of which majority of you are in med school, while 52% of you are graduates. So that's a good ratio. Perfectly fine. So we will discuss advantages of med school as well as if you are a graduate. Not a problem at all. Quick introduction of Moksh Academy. Moksh has been pioneer in license exam coaching for like many years now. We help especially for international exams, and since our learning methodology is patient centered, obviously we are poised to train you guys also for the upcoming next examination. We definitely never taught or never are into NEET PG, but we definitely are into patient-centered learning. So yes, we train for the United States medical license exam and all other international license exams. Prior to pandemic, of course, we used to conduct in-person sessions across 200 plus medical colleges in India. Thanks to pandemic, I mean, travel has been restricted, but not the reach of knowledge. So via these online webinars today, let me tell you, we have covered nook and corner of India, and in every session, we not only have students from India, but from medical colleges across the globe. So our endeavor is to give an unbiased career counseling session and a perspective to students in terms of choosing the right career pathway. All right. So today's session, feel free to ask any questions you guys have, and we'll be happy to help you in this journey. All right. The next important question. All right. What exactly is your future plan? Do you want to pursue PG abroad and come back to India, or you want to pursue PG and settle abroad, or you haven't decided? Because there are certain countries after which you can come back and work in India, and there are certain countries which are one-way route, after which you cannot think about coming back to India. Okay, so when we are doing this career planning, there are few considerations, and one of these considerations is the mobility. Okay, so decide what is your end goal. If there are commitments, you have your own hospital setup or a family setup, and you need to be back here, then choose the country accordingly. All right, so these are few factors and many more which we will discuss during the course of our session. One thing I just want to highlight, all of you, that as a MBBS doctor, okay, unlike all other specialization, one thing you need to understand, that our mobility is not that easy. What I mean by that, if there is an IT professional, today he gets a job in Canada, tomorrow he gets a job in America, day after he gets into Ireland, he can keep on changing the jobs as frequently as possible. But when it comes to the MBBS doctor, this mobility is not that easy, and there are various factors involved in it. So we need to understand this very, very clearly, so that there is absolutely no question. So now, with this consideration, let us first get clarity on few things, all right? First and very important consideration, okay? A question to all of you. Do you agree or do you believe that if you get a degree from a country, guaranteed you will get a license? Okay, that's a question to you because these are a few factors which you need to understand when you are understanding the international job placement mobility as a doctor. So my question to you, do you think if you have a degree from a country, guaranteed you will get a license from that country? Yes or no? Absolutely. Saurabh says no. Correct. Very correct. What is the reason? Until and unless you clear the roadblock or the challenge of license examination, get registered by the medical council of that country, you will not be allowed to freely practice in that country. So there is a myth, okay? There is a belief that, okay, if I have a degree from a country, I can guarantee settle in that country. This is not true. You need to encounter license exams and to get a registration. Second, which every medico in India has, which I also want to again highlight. Do you think doing a PG in a country guarantees you to settle in a country? Correct. Even this is not guaranteed. Why? Because of the visa, immigration, and other policies. Okay. But one thing is for sure, whether you want a license to practice, whether you want to do PG or you want to settle, okay? In any country abroad, whether you want a license, whether you want to settle or you want to do PG, you have to appear license exam of that country, okay? And this is exactly what we are discussing. So don't get confused. Many a times people assume that if I appear a license of the country, guarantee I will also get a PG, I will also get a license, and I will also settle. No, whether you will settle or whether you will get to go PG or you will get a registration, these are mutually independent thing, and there are other factors involved in it. So please get this clarity. It is nothing to do with skill shit. Everybody has a skill or can develop a skill, but more than there, it is about whether you are allowed or not, standard norms and protocols. Okay. So this is something I wanted to highlight before we discuss about various country options, so that you guys understand that yes, mobility is a big career decision. You cannot randomly, like it happens in India. Okay, let me try NEET once. If it does not work, I'll do something else. I'll do DNB. Basically, the trial and method does not work in international arena because of the time and the money involved. Time and the money involved is much, it's long, so you need to plan things accordingly. Okay, it's a career decision. To I have consultants at the age of 30, 45, 52 preparing for these examinations. So please understand, you cannot take these exams lightly. Okay, that is something which I want to kind of highlight. Traditionally, I have been interacting with students, with doctors, with consultants for last about 10 years, and my general observation for around 10 years has been that I have compartmentalized or identified that students who are planning their career in the field of medicine, broadly two types. Okay, listen to me very, very carefully. Country specific student or a course specific student. Now you may ask me, what do I mean by country specific student? A country specific comes to us and tells, I want to settle in America. Example, it does not matter which specialty I get admission into. And there is a category of student who definitely visits our offices and says, sir, I want to do surgery. It does not matter which country I get into. So your plan or your decisions will change accordingly. Okay. And if somebody says, okay, I also want to be country specific, I also want to be course specific. Well, in reality, at times it is not possible. Okay. So broadly, you might have to be in one of the category, and accordingly, the plan of action changes. Now you may ask me how. So if I am a country specific student, I am very clear that I have to do everything so that I get admission into America. So whatever requirements are there for that particular country, I will focus and only do that, which means maybe a non-clinical or a clinical or a paraclinical course, but I will just focus on that particular country. Now, if I am a course specific student, then definitely I should not ignore appearing NEET, or maybe in future, next, of course, everybody has to give. But what I'm trying to tell you is that India as an option, you should not rule out. Your Indian PG is very powerful, and I will prove to you at the end of the session. So all I'm saying is, if you are a student who wants a particular specialization, you definitely try for US or other countries, also Canada, multiple countries, but then do not rule out India also as an option. Okay, because Indian PG degree is very powerful, and you will be able to settle in a lot of countries if you have done a PG from India. Of course, this is too early for you guys to decide, but when you guys plan things, again, you need to consider this as one of the factor. Whether I want to settle in X country, course does not matter, or I am passionate about a specialty, country doesn't matter. So those who are selecting second option, take Indian exams seriously. Okay, I always tell, do not ignore your NEET PGs, because there are very limited options to do post graduation. To settle, I will let you know a lot of options, but to do PG, there are limited seats everywhere, not just India. So if you rule out India as an option, you are ruling out almost 40-50% of your chances to do a particular specialization. So this is very important. Okay, as expected, 24% of you are very clear. I just want to settle in a country, course does not matter. Wherein 76% says, yes, I'm passionate about a specialization. No problem. It is your individual choice. And after this webinar, I will let you know where we can do a one-on-one session, and individually we can do career planning for each one of you.